Now, I hope you all are doing well. Can we start the section? Okay, we can start with the renal system. So, you all know that renal system is helping for the elimination of waste product from our body. And there are a lot of functions for nephrons or kidneys in our body. So, we can see each of the functions. Don't worry, we can start with the basics. This is from the anatomy, physiology, and all other functions. Can we start? Okay, dears, we can start with the anatomy of the renal system. Okay, can all see my screen? Okay, so the anatomy. We all know that we have two kidneys. There are one pair of kidneys present in our body. It is placed retroperitoneally in our body. It is behind our abdominal cavity in the back of our body. So in the flank area, it is placed in the retroperitoneally. It is a bean-shaped organ which helps for the filtering of blood, and it produces urine and eliminated through the urethra. So we have two kidneys which help in the filtration of blood and eliminate the waste products from our body. And also there are two elongated tubes which carries the urine. We can call it as ureters. There are two ureters which help to carry the urine from the kidney to the urinary bladder, where the urine is stored in our body. And through urethra, it is expelled out from our body. Okay. So, where the blood is coming to the kidney for the filtration? We all already studied the circulatory system. In the circulatory system, from the heart through inferior vena cava, the blood is going towards the heart and from aorta, the blood is pumping through all over the body. Through aorta, the blood is coming through the kidney and it is filtered in the kidney, then going through the veins back through the heart. So, the blood is coming to kidney and it is filtered, urine is produced, then it is going to the urethra and stored in the urinary bladder. If it is fit, it is eliminated through urethra. Okay, is that clear? And also, we can see a small triangular gland in the apex of the kidney. It is the adrenal gland, which is secrete aldosterone and the hormones which help for the regulation in our body. So, these are the main anatomical structures in our body. If we are taking a cross section of kidney, we can see millions of nephrons in our kidney, which help in the process of urine production and the filtering of the blood. And also the nephrons have different parts which helpful for the filtration. So the glomerulus, the nephrons, the glomerulus is helping for the filtration of the blood. And the nephrons is placed in a cup-like structures. We can call it as a Bowman's capsule, which collect the filtrate. And there is a elongated tube. It is the proximal convoluted tubule. It helps in the reabsorption of water, glucose, amino acids, and electrolytes. All the water content, glucose and amino acids and electrolytes are absorbed from the blood in the proximal convoluted tubule. And the filtered blood is going through the loop of Henle. In that descendingly, again the water and sodium and chloride is also reabsorbed. Sodium, chloride and water is also absorbing through the loop of Henle. And then it's going to the distal convoluted tubule. There Again, further reabsorption is taking place and the hormones are also regulated in distal convoluted tubule. Then the urine is formed and it is collected through the collecting ditch, and all the final concentration and hormone regulations are happening, and the urine is formed, all the waste products are getting out from the blood and it is going to the urethra and then going to the urinary bladder. So is that clear for all? The pathway of urine from the kidney, there are millions of nephrons are present. So in the nephrons, the blood is got filtered, and in the proximal convoluted tubule, in different areas, there are proximal convoluted tubule, loop of Henle, and distal convoluted tubule are there are three main portions where all the reabsorption is taking place. In proximal convoluted tubule, the reabsorption of water, glucose, amino acids, and electrolytes are taking place. In loop of Henle, the sodium and chloride is absorbed, and in distal convoluted tubule, the hormone regulations and all the further reabsorption is taking place and urine is formed, and then it is moved to the collecting ditch, then going to the ureter and then to the urinary bladder, and the urine is got eliminated from the urinary bladder. Is that clear? Any clarification needed? Okay. Then we can go to the physiology. Physiology of renal system. The functions of renal system. The main function of renal system is to maintain the fluid and electrolyte balance. Okay. Sorry. Okay. Fluid and electrolyte balance. In the renal system, in the urinary tract, from the kidney to urinary bladder, all the sodium, potassium, electrolytes, bicarbonate, acid, all the regulations are taking place. The reabsorption of water, sodium, chloride, electrolytes, acid, bicarbonates, all are reabsorbed and the level is maintained in the blood. There is more sodium intake is there. The kidney is regulating the sodium level and it is keeping normal in our body. So the kidney have a great function in regulating electrolyte and fluid. The kidney is not functioning properly. We got all the electrolyte in high level, or otherwise we have a low level of electrolytes. And we can see all the kidney patients having edema due to this fluid imbalance in our body. So the kidney is maintaining the fluid balance. And also the other main function of kidney is the blood pressure maintenance. We all heard about the renin-angiotensin-aldosterone system, RAS mechanism. We can say laterly, it is helpful for the blood pressure maintenance. So, if there is due to any of the reason, high BP is patient having high BP, the renin-angiotensin mechanism is taking place and it will lower the BP and maintenance normal value is taking place. That how blood pressure is regulated in our body. And due to the excretion of acid and bicarbonate is conserved in our body, as acid-base balance is also happening by the renal system. The acids are excreting through our kidney, throughout the urine, and bicarbonate is retaining in our body. So, a acid-base balance, the neutral level is maintained in our body. Am I clear to you? Okay. And also through urine, all the waste products are got eliminated. The renal system is eliminating urea, creatine, all the drugs we are having and all the toxins we are having. If any of the toxins or any of the medications we are taking, all metabolism and all the things are taking place, all the necessary things are taking place, and the toxic, the unnecessary materials are removing through the kidney. That's why If any of the medication, the doctors are checking renal functions before the patient is taking any of the medication. If the renal system is the kidney function is not taking place properly, the medicine, the toxic substance are not eliminating through our kidney. That's why we are checking the kidney function. Otherwise, it will be accumulated in our body and causes many other problems. More than effect will be causing most worsen condition. And also hormone secretions. The kidney is helpful for the erythropoietin secretions, which help in the RBC production. And also renin. The renin is secreted from the kidney, helping the blood pressure monitor and calcium regulation by the calcium. That's why in CKD patients, the chronic kidney patients, we are after dialysis and all, we are giving erythropoietin injection for the RBC production. Because the kidney function, kidney disease and all, the kidney function is not taking properly. Dialysis is doing the function of kidney. So we are giving erythropoietin injection. The kidney is not regulating the hormones, erythropoietin and all not regulating properly. So we are giving erythropoietin injection for the RBC protection and renin for the blood pressure monitor and calcium for the calcium regulation. Okay, so the function of renal system is clear for all of them. Okay, just we can discuss the renin angiotensin aldosterone system RAS mechanism. It is not much important, but just we can get an overview. You can just understand how it is taking place. So the kidney is secreting the hormone renin. In case of any BP fall or any lower level of sodium, the BP is decreased or sodium level is decreased, the kidney will release renin. And this renin, the angiotensin is converted into angiotensin 1 in the presence of renin. The renin will be helping for the conversion of angiotensin to the angiotensin 1. And this angiotensin 1 is converted into angiotensin 2 with the help of angiotensin converting enzyme, ACE enzyme. Angiotensin converting enzyme is converting angiotensin 1 to the angiotensin 2, which help in the systemic vasoconstriction. This vasoconstriction will increase the blood pressure. Okay, it will angiotensin 2 will be helping in the systemic vasoconstriction, and also it helps for the stimulation of aldosterone, and then sodium and water will be retained. This is how the BP and the sodium is got increased. If there is any BP fall or sodium fall is the renin will be released from our kidney, and angiotensin will be converted into angiotensin 2 and angiotensin 1 by the presence of angiotensin converting enzyme, and it will help for the release of aldosterone and the sodium and water retention in our body, and ADH will be produced by the pituitary gland. So this all will be helpful for the increase in our BP, and the sodium level will be increased. If this is the normal mechanism happening in our body, in everyone's body, the RAS mechanism, due to any of the reason, if we are not taking food or we are not taking adequate sodium and all, this renin angiotensin mechanism will be taking place. It is the normal function. If it is got overactive, there will be the renin angiotensin mechanism is getting overaction. So the vasoconstriction is taking place always, and it will be leading to the hypertension, heart failure, and the kidney disease. The BP is high. Always the BP is getting high, and this will result in the kidney disease and the heart failure. And we can block it by giving ACE inhibitors, angiotensin converting enzyme inhibitors can be given. So the angiotensin 1 is not converted into angiotensin 2. We are inhibiting, or otherwise we are blocking the enzyme. So angiotensin 1 is not converted into angiotensin 2. So there will be BP will be decreased, or sodium level will be decreased. Or otherwise we can see angiotensin receptor blockers also can be given. So these all will be block the angiotensin 1 to angiotensin 2. Conversion of the angiotensin 1 to angiotensin 2. Okay, this is the normal mechanism, RAS mechanism. Okay, is that clear for you? Okay. Next we can going for some of the normal values. The normal urine output. The normal urine output is 0.1 to 1 ml per kg per hour. Per hour, the urine is formed in our urinary bladder is 0.8, or otherwise in the kidney. The filtering of blood is happening per 0.5 to 1 ml per hour. Approximately 30 to 50 ml per hour of urine is formed in our body. Okay. This is very important. Very last, what is the value of urine output per hour, per kg, or according to per ml? It is 0.1 to 1 ml per kg per hour, or approximately 30 to 50 ml per kg. Okay. Then the creatine. Creatine is excreted through our body. It is not an essential material in our body. It is a waste product formed by the different reactions. So we need to excrete it through our body. So the normal value of creatinine is 0.6 to 1.2 mg per dl. This is the best indicator of renal function. If it is in normal value, we can find out that the kidney is working properly. The amount is increased in our body, which means the kidney is not functioning properly. The waste products all are accumulated in our body. So the normal value of creatinine is 0.6 to 1.2 mg per dl. Okay. Then the one, blood urea nitrogen. All are the waste products. Okay, it is 7 to 20 milligram per dl. It is 7 to 20 milligram per dl. If the blood urea nitrogen level is increased with the patient is severe dehydrated, or due to increased protein intake, mainly in the animal protein and all, the organ meat and all. If we are taking continuously the organ meat or high intake of organ meat, there will be the nitrogen level will be increased in our body, and also indirectly or directly connected with the renal failure, because the waste product is not eliminating from our body. Means if kidney is working properly, the waste will be eliminated from our body. In case of nitrogen level is increasing, that means kidney is not working properly. The waste is accumulated in our body. That's why the nitrogen level or other waste product levels are increasing in our body. Then next is the GFR rate, glomerular filtration rate. It will be greater than or equal to 90 ml per minute. The filtration, the glomerulus is filtering greater than 90 ml per minute. The glomerulus is filtering the blood. If it is less than 60, which means it is the kidney disease. According to this glomerular filtration rate, we are staging the chronic kidney diseases. If it is greater than or equal to 90 ml per minute, it is normal kidney, and as per decreasing the GFR rate, we are staging stage 1 kidney disease, stage 2, and if it is less than 30 per ml, we confirm it as a end stage renal disease. Okay. In renal failure, we can see the metabolic acidosis. The acid is not excreting through our body, through the urine. So we can see metabolic acidosis and hyperkalemia. The potassium rate will be also increased and the kidney is not producing erythropoietin. So RBCs are not producing, then it will be result in the anemia. So most of the kidney patients we can see anemia. Next we can go for the imaging studies. First is the renal ultrasound. It is a non, like any of the ultrasounds, it is a non-invasive test and it will be helpful for to identify any of the renal calculi, any kidney stone and all, or any obstruction, any cancers, any cyst is present in the renal system, we can identify through the ultrasound. And also next is the CT scan, also the imaging study to visualize the kidney to identify any structural abnormalities or any obstruction or any changes in the renal tissues we can identify through CT and MRI. CT can be done by contrast method or without contrast we can do it. If the kidney failure is, there is patient with kidney failure, we will not do with contrast. First, before contrast, we need to check any allergies for iodine. Iodine allergy should be checked before we are giving contrast for the patient. And also after that, we should instruct the patient to drink plenty of fluids by through urine only the contrast is getting eliminated. So we need to drink plenty of fluid. We need to instruct the patient regarding plenty of fluids to be drink through flush out the contrast from our body. Otherwise, it is a toxic substance. So the patient is with any of kidney diseases or any renal impairment is diagnosed, we will not be giving contrast for that patient. We will be taking plain CT for that patient because the kidney is not able to eliminate the contrast or toxins from the body. Okay, is that clear? Is everyone clear? Okay, then the MRI, we can get the soft tissue detailing. And before MRI, we need to remove all the metal things. Then KUB X-ray, kidney, urethra, bladder X-ray can be taken to identify any stones, obstructions or any of the organ size. And intravenous pyelogram can be done IVP. This is also a dye study to diagnose any of the abnormalities in the urinary tract. Before the study also we need to check for any iodine allergy, and post the procedure we need to instruct the patient regarding the hydration. And next is the cystoscopy. Cysto means bladder, cystitis, bladder infection. Cysto means bladder. So cystoscopy means it is any endoscopy through the bladder. We are visualizing the bladder to identify any abnormalities in the bladder. And after the we need to instruct that in case of cystoscopy we need to educate the patient regarding after the procedure there will be chances of getting pink urine. The urine may be changed due to pink color. If it is bright color or bleeding or any clot is present in urine, we need to immediately report the healthcare. Pink urine is an expected outcome. If it is bright red urine or any clot are seen in the urine while urinating, we need to immediately inform the healthcare. Okay, so there will be chances of getting questions like after cystoscopy the patient is going getting to the home, and first in the time of first urination the patient see a pink color urine. So what is your assessment, or what will you educate the patient regarding that? And in the choice, there will be different options. You need to report the healthcare or go for further studies and something like that. And also it is a normal thing. So if it is pink color, we can teach the patient it is the expected outcome after cystoscopy. Pink color urine is normal. And instead of pink color, if it is bright red or any clot the patient is seeing, we need to educate that it is not normal, it is abnormal. We can go for the any other test, or we need to report the physician. Okay, is that clear? Is such type of questions you are getting? Okay, what will be the priority, like that? Then the voiding cystourethrogram can be done. It is to check for the reflexes. There are reflex incontinence, are the urinary bladder dysfunction is there. Due to reflexes, the bladder is not functioning properly, so there will be continuous leakage of the urine. So to identify such conditions, or to identify the reflexes are taking place properly, we can go for the voiding cystourethrogram. Okay, then the renal scan to identify the blood flow and the function of the arteries. And okay, these are some of the imaging studies related to the renal system. And we all know that regarding the urine formation. First, the glomerular filtration is taking place. All the electrolytes, water, all the substances are reabsorbed from the tubules. The filtration is taking place, and tubular reabsorption. The tubules are reabsorbing all the electrolytes. The fluid will be moved from the renal tubule into the capillaries, and the fluid is reabsorbing. Then tubular secretion. Third step is the tubular secretion. Fluid will be moved from the capillaries into the renal tubules and get eliminated. And urine is formed, and we are eliminating the urine. Okay. The per hour we are producing 30 to 70 ml per urine per hour. Okay. And just some terms related to the renal system. We all know that dysuria means painful urination, and noturia means excessive urination at the night, and the frequency of urination will be increased at night. The patient will be going for 3 or 4 times urination to pass the urine at night. While he or she is in the bed, the patient will be going 4 or 5 times for the urination. Then hematuria means blood in the urination. Frequency is more than every 3 hours. The voiding will be more than every 3 hours. And the urgency is the strong desire to void, and incontinence, the involuntary voiding or leakage of the urine. Then enuresis, it is the bedwetting. Proteinuria, we can see proteins in the urine. Normally, the proteins are not seen in the urine. In proteinuria or some of the conditions, glomerulonephritis or nephrotic syndrome, we can see proteinuria. The glomerulus is not taking, the function is not taking properly, so we can see protein in the urine. Oliguria means the amount of urine will be decreased up to less than 400 ml per day. Less than for the urine output, the total urine output will be less than 400 per ml. So we can call it as oliguria. And anuric means absence of urine, or the urine output will be less than 100 ml per day. Per day, in one day, the patient is only producing 100 ml or eliminating 100 ml per day. Okay, and maturation means voiding. Okay, is that clear for all? Any doubts? This is the anatomy, physiology. and the RAS mechanism, some of the normal values we studied, and some of the investigations we studied, and some new terms related to the renal system. Is that clear for you all? Any doubts? Okay. So today we can stop with this. If anyone have the doubt, you can ask me, or otherwise we can stop the class. Okay. Thank you all.